Hi, my name is Dr. Brady Wyrick, and I'm the only board-certified chiropractic neurologist in southeast Idaho. I've been in private practice in Idaho Falls now since 2006, and I consult with hundreds of doctors around the country, and I'm the founder of Idaho Chiropractic Neurology and the website painfreeidaho.com. Today we're going to talk about how to end your struggles with peripheral neuropathy. So if you have burning in your hands or feet, or numbness or tingling feelings in your hands or feet, this video is for you. Now, you're watching this video because you've been told there's no cure. You've been told that it's all in your head, and you possibly have been told that there's nothing that we can do. Or you've been told that your test has come back and it's normal, we don't know what is wrong with you. Well, this video is for you. So if you're tired of running from doctor to doctor playing Russian roulette with different medications, here, try this one, try that one. They don't work. If you're tired of being on that medical merry-go-round, and if you're tired of taking drugs that haven't fixed the problem, well, this video is for you. I'm here to tell you today, you're going to hear some new things on this video. You're going to hear some things that you've never heard before. You're going to hear some things that your doctors never told you before. But I'm going to tell you right now that there is new hope. Now, the first question you should be asking is, what is going to make me different from any doctor that you've seen? And that difference is that we treat patients metabolically and neurologically. I'm here to tell you that we leave no stone unturned in finding the direct cause of your peripheral neuropathy. I'll guarantee you that no one has told you what I'm about to tell you. What I'm going to address is what makes my program unique and how I successfully treat peripheral neuropathies. We successfully treat these by using metabolic and neurological protocols. And when I say metabolic protocols, what I'm talking about is testing and treatment. For example, one of the things that we test is called sensitivity testing. We do sensitivity testing to determine if you're sensitive to gluten, eggs, soy, yeast, or milk. If you're sensitive to any of these things, it could be causing your peripheral neuropathy and actually making your condition worse. The other thing we do is complete blood panels. We look at all of your blood work. So if you have blood work you've already done, great. Bring it to the office with you. I want to see it. But what I'll guarantee you is that no one has dug deep enough to find exactly what's going on. We want to assess every system in your body so we know how to correct it and what we can do to fix it so that you can get better. The other thing that we run is called an adrenal stress index. You have some adrenal glands that sit on top of your kidneys that secrete a hormone called cortisol. So too much cortisol can actually cause, or too little cortisol can cause the symptoms of peripheral neuropathy. So the only way to know where your cortisol levels are at are to actually do the tests. Another thing we run is called an immune panel. These are extremely important in cases of peripheral neuropathy and other chronic diseases. You have two cells in your immune system. They're called Th1 and Th2. If Th1 and Th2 are out of balance, it could be causing your peripheral neuropathy, along with many other autoimmune conditions. The only way to do that is to run the immune panel, and I can guarantee you that your doctor has not run this deep of an immune panel to find out why you're having peripheral neuropathies. The other thing we do is specific neurological testing and treatment. Your peripheral neuropathy can be caused by three different areas. It may be coming from your feet themselves, it may be coming from your spine, or it may even be coming from your brain. We can assess all three of those areas and provide a service called brain-based therapy to make those areas stronger so that you can feel your feet again. One of the things that we use is called the Rebuilder. The Rebuilder is a simple electrical device that hooks to your feet and uses the same wavelength of electricity that your nerves do. By doing this, you stimulate the foot, the spinal cord, and the brain to help that system function better. Another thing that we can use is exercise with oxygen therapy. When we provide oxygen with exercise, it actually makes brain pathways stronger, and it has been clinically proven to help in treating chronic diseases. Once we've run the necessary tests to determine the specific cause of your peripheral neuropathy, successfully treat your peripheral neuropathy using neurological and metabolic protocols. I want to be right up front with you. We don't accept every patient into our care. If you're not willing to make lifestyle changes that are going to help you get better and take responsibility for your own health care, we're not going to accept you into our program. What I want you to ask yourself is, number one, how has your peripheral neuropathies affected your relationships, your finances, your family, or other activities? Number two, what has your peripheral neuropathy cost you in time, money, happiness, and sleep? Number three, where do you picture yourself the next 1 to 5 years if this problem is not taken care of? And finally, number four, what is it worth to you if we can improve your condition? I want you to ask yourself, am I a candidate for this program? And how to determine whether or not you're a candidate is by making an appointment by calling 523-1620 or visiting painfreeidaho.com. If we accept you for care, that means your life is going to change. The only way to find out is to call and make the appointment. Thank you.